Hello, this is Dr. David Green, CEO of the California Pain Network. Today's topic is the basics of migraines. A migraine is a chronic headache that affects people from anywhere from a few hours up to 72 hours straight. It's a complicated, recurrent headache disorder that's most common in women and those between the ages of 15 and 55. Most become less severe and less frequent with age. It affects 18% of women and 8% of men. 30 million in the U.S. have at least one migraine per year. That's about 10%. Every 10 seconds, someone in the U.S. goes to the ER with a headache or a migraine. 70% have a first-degree relative who suffers. If a parent suffers from migraines, there's a 40% chance that a child will suffer. And if both parents have migraines, that chance goes up to 90%. More than 90% of sufferers are unable to work or function normally during their migraine. So what causes them? There's just a lot that we don't know. We know that there is a genetic component and an environmental component. There's an imbalance in brain chemicals. The serotonin levels drop during migraines. We know that. Low serotonin can trigger a migraine by letting too much blood flow through vessels that should be constricted, and that induces a throbbing sensation. Typical migraine triggers, there's a lot of them. Foods could be aged cheese, red wine, beer, whiskey, food additives, cold food, citrus foods, MSG, or caffeine. Elevated stress can trigger a migraine, changes in barometric pressure, strong scents such as in perfume and paint, hair accessories if you pull a ponytail tight, exercise, poor posture, skipping meals, and smoking, believe it or not. Chocolate. The small silver lining here is that there's no evidence to clearly substantiate that chocolate is a trigger of migraine headaches. That is actually a myth. The symptoms, it's often a unilateral head pain that is throbbing and aggravated by activity. An aura is a visual or sensory symptom prior to the onset of the headache. This can include photophobia, visual scintillations. 80% of migraines actually have no aura whatsoever. There's no objective testing available to diagnose migraines. A CT or MRI can rule out badness that causes similar symptoms, but that's not going to definitively show a migraine on those studies. It's diagnosed on patient history and pattern of symptoms, and a migraine diary can actually be very helpful. So the International Headache Society requires a patient to have at least 5 attacks fulfilling 3 of these criteria: 4 to 72 hour duration, at least 2 out of these unilateral, pulsating, moderate to severe pain, aggravation by or causing avoidance of routine physical activity, and at least 1 of these, nausea plus or minus vomiting, photophobia, and phonophobia. Photophobia is sensitivity to light, phonophobia is sensitivity to noise. Abortive treatment options. So if you already have a migraine, here's some ways to abort it. The triptans, such as sumatriptan, they target serotonin. Okay, almotriptan is Axert, elatriptan is Relpax, frovatriptan is Frova, naratriptan, rizatriptan, and then sumatriptan, which you can see to the right. Zolmatriptan is Zomic. All these pretty much work the same way. Acetaminophen, there's a drug called Migraine, which is a combination of acetaminophen, isomethiptane, and dichlorylphenazone. Migranol nasal spray, Cafergo, and then over-the-counter medications such as Advil migraine, Excedrin migraine, and Motrin migraine. Narcotics can help with pain relief during a migraine, barbiturates. And then for the nausea, you can take Reglan, Compazine, or Phenergan. Now, preventive treatment options are those that are taken to try and decrease the frequency that you actually have migraines, with the goal being to lessen the frequency and the severity of when you do have one. So high blood pressure medications such as beta blockers and calcium channel blockers, antidepressants can actually help prevent them. Elavil, Pamelor are examples. Anti-seizure medications, including gabapentin, Topamax, Depakote, and then Sonomagran is a serotonin antagonist. There are interventional treatments, one of which is Botox. Botox has been FDA approved for years for those with chronic migraines. You can get these in 3-month intervals. They're injected into 32 sites in a 10-minute procedure. So it's very quick, but there's a lot of places where it's injected. And it's covered if certain medications have been tried and failed. For chronic migraines, it needs to be a distinct and severe neurologic disorder characterized by patients who have a history of migraine and suffer from headaches on 15 or more days per month. Okay, so you have to have a headache like every other day on average. Patients treated with Botox average 8 to 9 fewer headache days per month compared to baseline, and as demonstrated in this preempt study. So it's very effective, and that's how it got FDA approved. Additional interventional treatments can include occipital nerve blocks. They're over 50% effective. Cervical facet injections, cervical epidural injections, phenopalatine, ganglion, supratrochlear, supra or infraorbital nerve blocks. And then if an occipital block works, you can actually do a pulse radio frequency to get longer-term pain relief. All of these have their place. In a study of 100 patients receiving greater occipital nerve blocks, 53% achieved pain relief averaging 3 weeks. A retrospective study on the efficacy of greater occipital nerve block for refractory migraine patients included a mixture of lidocaine and steroid for a nerve block. 54% of migraine patients reported being significantly better, and this duration lasted up to 6 months. So that's very good. For this last study on here, they looked at peripheral nerve blocks and the treatment of migraine. They assessed 27 migraine patients before and after greater occipital nerve and supraorbital nerve blocks for a maximum of 10 injections with 85% effectiveness rate for 6 months. So once again, very good outcomes. The top non-operative pain management throughout California is with the California Pain Network. There are pain clinics all the way up and down the state, from San Diego all the way up to San Francisco and Sacramento, LA, Orange County. There's over 50 insurances accepted with over 25 treatment options being provided. The overall success rates exceed 90% for pain relief and for avoiding surgery. The pain doctors are board certified and award-winning. So visit us today online at CaliforniaPainNetwork.com and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Green with the California Pain Network. Your pain stops here.